So how worried should we be about the vaccine rollout and what's causing the problems?
Australia has fallen way behind. Presently in international rankings, we're somewhere about number 90, sandwiched between Guyana and Albania.
Bill Bowtell is a health policy consultant and a former advisor to Paul Keating.
Now, the United States is vaccinating every day about 3.2 million people. In the United Kingdom, 50% of the population has been vaccinated. Australia has fallen behind, and it has fallen way behind because of political decisions made even 6 months ago. The one thing they did right in the United Kingdom at the end of last year was that they backed every horse in the race. Pfizer, Moderna, J&J, Novavax. And that meant that they had a very large supply on hand. Now, we decided to go with AstraZeneca with effectively one supplier and some Pfizer, and the supply has not been delivered. The Prime Minister said there would be 4 million doses administered by the end of March, and it's just under 600,000, 10% of that.
How much of an obstacle has the supply chain been? You know, Italy blocking the export of 250,000 doses, for example. I mean, pretty hard to foresee that sort of thing.
Well, there are always ructions, but the whole world faces these problems. There's nothing particularly better or worse about the problems that face Australia, but we restricted the amount of vaccines that we could have available in early 2021 by the decisions we made. And I guess the idea was that there would be much more vaccine coming through from CSL and with AstraZeneca. Well, that hasn't come to pass. Okay, so what do we do about it? We have got to increase the supply of vaccines. We cannot drag this out month after month after month. We are in a race. And people who say we are not in a race have not really been paying attention. We're in a race against the emergence of variants, much more transmissible and deadly variants. We have got to 0-0 in Australia, and we have a window of opportunity to lock that 0-0 in if we vaccinate the entire Australian population.
So do we have enough vaccines here right now to ramp up the pace at this time?
Well, we do. We know that 1.7 million of those doses are sitting on warehouse shelves at the moment, unadministered. Now, a vaccine that sits on a shelf is no good to anybody. So there are clearly problems with supply and there are clearly problems with distribution.
Yeah. Let me ask you about that, the logistical challenges. What are they in a nutshell? Can you take us through them?
So the failure is that where doctors have put in new fridges for AstraZeneca and for Pfizer, which has to be stored at a colder temperature, they're geared up for thousands of vaccines to be distributed a week. But what they're getting is 50 vials and 100 vials or maybe no vials of vaccines delivered. So the people who are making appointments to be vaccinated are being told at the last minute these vials aren't there and so on. We cannot take our time with this. The idea that we are not in a race is just not borne out by the facts. It is no use just waiting and watching and seeing what happens to see how the virus changes and mutates. The sooner we're all vaccinated, the happier, healthier, and better off we will all be.
Bill Bowtell, he's a health policy consultant. He's at the University of New South Wales. Well, this week, all of those frustrations erupted very publicly as federal and state ministers blamed each other for the failures.
Now, we're going to help the states, but they've got to admit they've got a problem because they've done 3/5 of bugger all. And they are holding this nation back.
Every time the Morrison government wants to deflect from their failings, they launch an attack on the states and territories.
So let me make it very clear. I'm as angry as I have ever been in this 15 months of war against this virus.
So who is at fault here and how do we fix it?
So to be fair, Linda, it's the largest logistic exercise that Australia has ever gone through. Getting 2 doses of vaccines into 20 or so million people is a big task.
Stephen Duckett is a health economist at the think tank the Grattan Institute.
But on the other hand, the Prime Minister announced the vaccine program back in August of last year, and so we've had plenty of time to prepare. Back in December of last year, 2 logistics companies were contracted to actually get the vaccines from the warehouses to the GPs and so on. And so really we should have got it right by now. That it's been a logistics nightmare.
We've seen this federal-state blame game erupt this week, quite unseemly. But is it those logistics companies that are doing a poor job here, or is some level of government responsible?
I think the Commonwealth Government saw this as an entirely a good news story that was going to have a perfect rollout. We're all going to be happy. We're going to go to an early election with everybody vaccinated in September or October. Unfortunately, as the vaccination program has turned pear-shaped, the fingers started to point everywhere except me, and so you've ended up with this Commonwealth state blame game. The states are quite rightly saying, look, if you don't tell us until the night before how many vaccines we're going to have tomorrow, we cannot do any planning. We cannot actually make sure they go to the right places. And then you actually deflect the problems of the vaccine rollout onto us in the hope that we'll just grin and bear it.
So the Commonwealth sends the vaccines onto the states and the states then distribute them to the GPs.
So unlike all the rest of the health response to the pandemic, the vaccination program is led by the Commonwealth. They negotiated the vaccination deals. They're the ones responsible for the distribution. They allocate some vaccines to the states. And so the Pfizer vaccine basically went to the states, and the states were told, vaccinate your quarantine workers, vaccinate your healthcare workers. And they did that not necessarily as well as they ought, but they're doing it. And they've actually distributed a very large proportion of the vaccines they received. The Commonwealth then said, we will arrange with these logistic companies to actually get the vaccines to the GPs. So the Commonwealth goes straight to the GPs, and the Commonwealth goes to the states who get it to the hospitals.
So, in your view, is it clear who's right and who's fouled up here?
The whole program has had a number of bungles associated with it, but basically there hasn't been a sense of urgency. Basically, the wrong model was adopted from the start, with sole reliance on GPs for getting the population vaccinated, when we really should have engaged the states and had mass vaccination centres as well. In a sense, if you think about it, a GP rollout strategy, it's a good thing to do. That is, it's a good thing to allow GPs to vaccinate their patients. GPs ought to provide a comprehensive primary care service. But a boutique strategy relying on general practice clinics, which are essentially small, they have small waiting rooms. You can't actually line up a whole lot of people to be vaccinated. You can't actually sit down a whole lot of people to be observed. It's a boutique strategy which will not deliver the numbers we need to be delivered. And so you've got to actually do a mass vaccination strategy as well, not as an alternative, as well.
So we should be lining up those sports stadiums and cathedrals right now.
We should be out now, and we should be saying, look, CSL is producing about 1 million a week. We need to make sure there's 1 million places a week where people can get vaccines into their arm. Let's step back and make an honest appraisal, and let's start again, because it really is important for us to get this vaccine rollout right and get it done quickly.
Stephen Duckett, thank you very much.